So I just want to officially welcome everyone to our State Technical Assistance webinar. Just a note, of course, about our funding sponsor and that this project is supported by HRSA, and that the information and content and conclusions should not be construed to be as inferred as being endorsed by them or the government or anyone else. This is our information and our opinion. And just a few notes. We've updated this initial slide just to bring forth a few things that we want to make people aware of as far as accessibility and engagement. We want to make sure that everyone knows that you can use the closed caption function using the button at the bottom of your screen. We're going to do our best throughout to provide verbal descriptions and summaries of things that are in the chat, and all of our follow-up materials, such as recordings and handouts, will be available, and they will meet or exceed compliance guidance. And then I know a lot of you have been on these calls before. We definitely want these to be engaging. We want you to use the chat throughout. Please stay muted when you're not speaking, just to cut down on background noise, but please feel free to unmute and ask a question. Or if you have a great example, Sarah and I, have worked together before. We're both very comfortable facilitators. And so you really are welcome to unmute and ask a clarifying question, or give your own example, your own thoughts about something, because we really want this time today to be of best use to all of you. If possible, when we're having discussion, we'd love for you to turn your camera on to facilitate our being connected and our engagement. As you noticed, we are recording, and just want to make sure that everyone is aware that the session will be posted publicly. This is a public webinar, and so even beyond our learning communities and folks that are already engaged with CSN, we might have some additional folks that join or that find this recording on the CSN website. So just be mindful as you're, thinking through things and giving examples, that this will be posted in a public platform. And then we really invite you to rename yourself with your state abbreviation. If you put your state abbreviation before your name, it'll be a nice way to see who else is on from your state that maybe you actually aren't already collaborating with, and might be a nice opportunity to find out who else is doing similar work in your state or your area of the country. We also have added these community guidelines. We use these in other projects that I'm a part of, and just want to, set this up with what we expect will be how we will kind of all be in this space together for the next little bit of time that we're here. We really ask that you focus on being able to be present, which I know is difficult, that sometimes you've got your emails are going off and your phone's going off, and there's always things happening in the background. But as much as you're able, we ask for this time that you're really able to focus on being here for this time together, that you bring a curious stance, that your questions or maybe thinking about what someone else is saying, comes from a place of like, oh, I wonder why they might think that, or I wonder why this is. We want everybody to be partners in learning, which means both being a teacher and a learner, offering things from your experience, as well as asking, questions, feeling vulnerable to be able to ask about challenges that you might have, and know that the rest of us in this space here can hold space for that, and help think through things together. We ask that you honor that all of us come with different perspectives, different lived experience, different learning styles. And we have really tried to create this space today to make the most for everyone to be able to participate, but we want all of you as participants also to be mindful of that, and always take care of yourself as needed. If something it feels upsetting as we're talking about it, and your brain is saying, oh, we're going to take a little break, or, maybe life right now is just very stressful and your brain needs to just turn itself off for a minute, or you need to take a bio break, please take care of yourself as needed. That is what is most important. So again, official welcome to our State Technical Assistance webinar. This is part of our Quality Improvement 101 series, and today is about planning for integrating health equity and child safety. I'm Claire Grace Jones, and I am a Training and Technical Assistance Associate here at CSN. I prefer to go by Claire Grace. I actually am going to introduce our presenters, but wanted to let you know that unfortunately Rebecca Bishop is not able to join us today. And so I am going to step in and facilitate that portion for her. We also have Sarah Ivan, who I am so excited. I have worked with at EDC on other projects and is amazing. And I am realizing that I'm the one that was supposed to be reading her bio and I forgot to print that out. But so you can take my word for it. You can go back on the website and look at it. But I will tell you that Sarah is just not only a wealth of expertise and information, being an epidemiologist, which always just impresses me to begin with. But I think what impresses me about her the most is her ability to translate things in language that helps people like me that are not always like data driven and research like deep in the weeds. I think her style really helps to translate all of these things into a way that is very accessible, both for all of us as professionals and also for things that we want to bring to our partners and our community members and other folks. And so, Sarah, if there's anything else that you would like to share of note from your bio, because it is long and amazing, and I really apologize for my unpreparedness here, please feel free to jump in with that. Otherwise, I'm going to hand it to you and I'm going to stop talking.
Claire Grace, you're way too kind, and I'm just happy to be here with all of you today. I do have some experience in working in quality improvement and in maternal and child health. I worked on a number of maternal and child health bureau projects, so I'm really familiar with a lot of what you all are dealing with, and I'm excited to be here today. We are going to dive right in with a few principles to talk about health equity. So that's what we're here to talk about, is using public health data to drive equity. These are a set of principles that were developed originally by the CDC Foundation via a grant from the Robert Wood Johnson Foundation. The CDC Foundation did an environmental scan to identify some best practices in research to build an equity-oriented data profile. So these are some things to keep in mind as we're thinking about and shift our thinking about how equity-mindedness throughout the entire data life cycle can shape and create some more data-focused and equitable focused systems within what the work that we're doing. So here are the five principles, and I'm going to ask you all. We're gonna start this off really quickly, and I want you all to be interacting with us as well. Is 5 principles to consider. The first is recognizing and defining systemic factors. So history should inform the future efforts to appropriately engage with communities that have previously been harmed and to mitigate any future harm through data collection and program implementation. So for example, one way that I would do this is if I'm conducting a needs assessment and I'm talking with folks, if I understand that the community that I'm working with has been through some sort of trauma, that I will explicitly acknowledge the systems, policies, and practices that have left historical inequities and influence the links to the health outcomes before we even start the conversation. So acknowledging that, creating a safe space. So that's the first principle. Is making sure that we're recognizing and defining those systemic factors, and we're understanding them, and we're letting people know that we work with, that we do understand those. The second, while similar, is using equity mindedness for language and action. So when collecting data, we hold the power in our language, like I just said, and having some equity mindedness examines unequal outcomes to identify patterns based on the categories, which can be subject to systemic and structural bias. So when utilizing data, this could look like engaging the community when developing new data measures, considering original intentions and limitations to your secondary data sources. So, if you're creating some new measures, maybe and you're working with youth, bring in some youth to talk about the issues and gather some data and let them take a look at the measures before you go collecting data, and you might get some really helpful information. The third reminds us to allow for cultural modifications. So in data, we like to have standardization, and that allows for comparison, which is really important, and to be able to compare across communities. It provides a level of utility of the data and can support and really can support some contextualizing of experiences if you're able to modify culturally based on the communities you're working with. And so you can balance that, the benefits of standardization with being able to be culturally relevant, use language in your measures and how you're collecting data to make it meaningful to the specific communities that you work with. The fourth is around creating shared data agreements. So where applicable, and when you're working with agencies and the community, being able to generate in writing a shared data agreement, which includes both the intent of the data, a plan for what will be collected, and who will be able to access it, and who will be able to make modifications. Is really important because it allows a certain amount of transparency. And when you're transparent, you're building trust, and trust is very important. Um, so I always say, get it in writing. I think that it makes it so that it's so much more useful later on in your long-term goals. And finally, and perhaps very importantly, is facilitating data sovereignty. And so data sovereignty occurs when the community controls the development of data sources and how the data is managed. Communities, including Indigenous and tribal communities, should be able to determine how the data will reflect their interests, values, and priorities because they are part of the community. And that will ensure that those statistics are useful to the needs and will be relevant in the future. Um, and I see a question came up, and that is absolutely great. How do you go about recognizing and saying the correct wording when talking to groups that may have been harmed in the past? So I think that it, of course, it needs to be tailored to your particular community, and we could probably do a whole presentation on how you could develop that sort of language. But I think that practice is really important, and there's likely some information out there. I sort of have a couple of ways of we do this on one of the projects that I work on. We actually take a few minutes in the beginning to recognize the structural inequities that exist in all of our communities. And taking those couple of minutes can be really impactful to those that you work with. So I hope that answers a little bit of your question. And Claire Grace, feel free to chime in if there's something more standardized that exists within CSN.
Yeah, no, it's not necessarily more standardized. I just would love to add also that, in my experience and actually what we do try to do in CSN is always is just asking. I think, and this is one of the reasons why in talking about today, also, we're really talking about the importance of having people that are members of the population that you're wanting to serve at the table right from the beginning. And so
Mhm.
I think coming to things with humility and saying, I'm not really sure, how should I be referencing the people that live in this community? Or we did this, you might have noticed if you're planning to attend our webinar next week on children with autism, but we noticed that in a lot of things that we were reading, there was that person first language of children with autism, but then in a lot of websites and talking to people that were autistic themselves, we saw that the language it was really being used as autistic person, and that there was this like real sort of cultural identity in that for especially some young adults and adults. And so, we talked to members of, both those populations and came to a decision about what language we thought was appropriate to use when we're promoting our webinar, but also then put a disclaimer with it to say, this is the language that we've decided to use based on members of this community that we've talked to, but we leave it to individuals to decide what they're most comfortable with, because in the end I think it's all about asking and about humility.
Completely agree with you, Claire Grace. And I think like leaving it open-ended at the end. So like give the best words that you can find and open up at the end and say, is there anything else anybody would like to add? Because that shows your own openness as well. All right. Um, any other questions? I can just pause for a quick second. If not, we're going to go to a little activity and get you all to interact a little bit more with us. So we're going to ask you to annotate on the slide which principles you've used in your work. And so to annotate, there's an icon in the bottom left corner of the screen. It's a pencil with a green circle. And if you click on that, you can choose a sticker under the check mark. You can choose one of these stickers here and then just mark which ones you have used. Um, and we would love to, you can also enter some further detail in the chat if you want and let us know how you've done that. Come off mute. This really should be interactive. Awesome. I see lots of folks use equity mindedness, recognizing and define systemic factors. That's great. Allowing for cultural modification and creating some shared data agreements. Awesome. Lots of folks have been doing this work. And if anybody wants to share an example, please feel free, either in the chat or coming off mute. We can take a minute for it. You all have been doing a lot of great work, it seems. I've done a lot of these principles. So
It's also fun to draw on the slide.
We were saying, and that is why we then disable annotation again when the activity is over. Which I just want to make sure that we have lots of time to hear all the things that Sarah has brought and to talk with each other. So I think it looks like the responses have slowed down. So I'm going to go ahead and clear the screen here and move us on to the next slide. If you give me just 1 second, Sarah.
Sure.
There we go.
Sure, no problem. All right. So as we've started to talk about, we've talked a little bit about equity and a little bit around some of the principles. But if we were to define what data equity really is it's practices that help to guide anyone who works with data, especially data related to people, through every step of the data project. So you're using a lens of justice and equity and inclusivity. Can you go back a slide, Claire Grace? I think we skipped one. There we go. And equity is not just the end goal, but it's also the framing from all the work we do from the collection, analyzing, interpretation, and distribution. We're all doing that through an equity lens. All right, next slide. All right. Data equity is incredibly important because we have an obligation in public health and in the work that we do with our communities for the greater good. Marginalized communities have often had limited access to the data due to structural factors, and that data can be used for the greater good, and it also has the potential to reinforce stereotypes and undermine equity efforts. With data comes power, and so it's important for us to be mindful about how we're using that data. It could really cause harm as well as give us power to create wonderful public health networks within our communities. So next slide. All right, a couple of keys to data equity. The first is ensuring that we're recognizing biases and influences of our experiences. We all bring our own experiences to the work that we do. For instance, I grew up in a rural location, a very rural location in the Northeast, where you had to drive an hour to a grocery store. I bring that experience. I don't live there anymore. I live in the Boston area, but I bring that experience and that lived experience with me. And the second key is involving the community. So let's not do anything about us without us, and we center our community throughout the data life cycle so that they're involved. One of my favorite ways of doing that is working with youth as part of a youth process and being able to engage with youth, being able to work with them, because with that, you get really great new ideas. So involving your community, whomever that might be, is really important. Next slide. All right. And finally, how do we address our biases? We could talk a long time about this, and perhaps we will as we get into some conversation. I think there's a few principles here that we have written down. One is understanding our positionality. What kind of position do you have in your community? You need to take that into consideration. Making sure that you are being humble about that and understanding who you are and how you come into the community to work with folks. Second, engaging in some honest self-reflection. So this is not only on your position, but also how it feels to work in contexts we work most often. It's important to make people feel safe. And to do that, we have to acknowledge the difficult climate in which people may feel unsafe to disclose information about their origins, anything about them. And so this requires our honest self-reflection. I think as colleagues, even um, being able to engage in this self-reflection is really important, and to be able to create some safe spaces. So hopefully this is one of those safe spaces and we can engage in some of that conversation. Um, Next is thinking and outlining strategies to mitigate the impact of biases. Um, and so it's using both qualitative and quantitative data to make sure that we're seeking out the information from multiple sources to unpack these really complex social issues. So never just rely on one data source, thinking about multiple data sources to tell the whole story. So this includes really incorporating perspectives from those who are both directly affected by the issue as their experts in their own circumstances and experiences, along with maybe a large data set that could tell us a lot of longitudinal data. That is the way to get the fullest picture. Um, Next is around engaging and ongoing monitoring. Again, just constantly gathering data to make sure that we're having some data equity. And then finally, as I've mentioned a few times, involving the community members and interpreting data, being able to provide lots of opportunities for engagement. Um, and I think we can go to the next slide to start some conversation, because that's really where we want to go. And we're going to actually pause. I know we've covered a whole bunch. Don't look at this question yet. Let's take 30 seconds to pause and allow everybody to process some of this information and think about any questions you have or anything else you want to reflect on with us as a group. And I see some questions coming in. Okay. All right. Anybody
Sarah,
want to? Yeah.
I
Go
was just going
ahead,
to say,
Terry.
hopefully the days are gone, but I doubt they are, of an expert data person coming into a community and saying, here's what's wrong with you guys, and here's how to fix it. Here's the data about you, without really even engaging those folks at a really beginning level. But I'm afraid that perhaps even in our rush to get things done or to meet goals, we may engage in some of that ourselves in a more subtle way.
Mhm.
Um, and so I think trainings like this, just to bring it back to our awareness, and then Melissa might want to speak to this too. Recently, we tried to engage some youth in developing something, and then it was like, too many legal things. Wait a minute, you're going to talk to kids? Wait a minute, it was about suicide. So, we had to and we pretty well, they just kind of ran out the clock on us in terms of we ran out of time, and so we had to use some of our own family members indirectly, youth to influence, and wasn't probably as robust as it could have been. So there's all kinds of challenges, around this making sure that data collection and data management and the utilization of data is done with this lens. And I just want to admit that we're having trouble. So it's and it's okay if other people are, because I imagine that we're not the only ones here in Tennessee. And that's just one instance. I mean, for the most part, we try to do the kind of things you're describing, but I still think we could do it better.
Yeah, I mean, I think having these conversations is the first step. And so happy that we're able to do that. And I appreciate you weighing in, Terry.
And Sarah, I can see, so speaking of Melissa, she had posted in the chat about suggestions on how to navigate times when data can undermine equity efforts. And Melissa, I'm curious if you want to come off mute or say a little bit more about that in the chat. And Sarah, I don't know if you want to start to address this, if you'd rather have a little clarification first.
I mean, I'd love some context. I've definitely seen when this can happen. It's always a little jarring to me. Like I step back, like, wow, I can't believe the data is being used in a way that is not what we intended. And I think there's a lot of ways you could reframe it. But Melissa, if you want to give us some more context, that might be really helpful.
Yeah, well, I think I just kind of wanted some clarity on what exactly you meant by that, because I got that, like I saw that you put on one of the slides that was one of the challenges, that sometimes data can be used to undermine equity efforts. So I was just kind of wondering specifically like examples where you've seen this and how you would suggest going about navigating times where that happens.
I mean, I think that, so I've seen it happen lots where, so I do a lot of work in substance use prevention. And so we see data that comes up that says XYZ is more prevalent in this community. And maybe it's not framed in such a way that is really in line with equity. And so reframing that data to say like, okay, but if we actually look at it this way, maybe it's not, or we look at the other factors, we look at risk and protective factors, that it's not as simple as it's one group or it's something on that idea. Claire Grace, you're shaking your head. So
I can give an example.
Please go for it.
Please do.
Okay. And again, this safe space to talk. We don't share this information outside of our STAW group, right?
So, well, actually, hold on. Before you say that, just a reminder that this actually is a public webinar and this is going to be posted publicly. So
okay,
share what you're saying with that knowledge.
Okay, I will share what I'm saying with that knowledge. So an example would be taking a data set on maybe a health behavior practice that indicates feedback directly from, I'm going to give the example of parents and caregivers, or let's do mothers and a health practice, and gives that the majority of mothers reported that this is why they did not engage in this health practice. But contextually, if we're using that at a state level or even at a community level, how we narrate that message and provide the context to that message doesn't take into account all of the systemic factors that may result in moms, like this subset. Let's say, I'm going to give an example of, say, Black mothers don't XYZ, and it's not, I'll say, put babies on their back to sleep. That's not what we found in Texas, but I mean, it is an issue everywhere. But I'm just saying, this is my example, and we have had examples of this. If we're looking at an infant health practices survey that comes out, are we aligning that with all of the structural or systemic barriers that exist to that? Are we recognizing that there's a also issues systemically that are preventing? It could not be will. We're just saying that this isn't happening.
Yeah.
That doesn't mean that the will is not there for it to happen. There could be a lot of other factors going on. So how we frame that message and present that data is crucial in
Yeah.
we have to recognize beyond this behavior is not happening in this subset of the population.
Yeah.
That's very dangerous to present if we're not providing context. And I will say one area that we're looking at beyond that, we've had that example happen and we've had to pull back and say, hold up, I'm not sure that it's responsible of us to put this out there on a dashboard or anywhere else without providing, context to that or recognizing the systemic issues that may be involved. So that's A. And then B, one area that we've learned through Child Safety Networks, CSLC, the resource of, we're looking at, resources that have been shared related to safe infant sleep specifically, because I'm on the SUID team, and how to get communities involved in improving the data collection. It helps, at systems levels, but also working locally, for instance, with their child fatality review teams, to engage in that data collection, where those barriers might exist, and even how to ask the questions to improve that data collection that are respectful of the cultures within that community. Does that make sense? So it's even how the message is framed, and I know we're looking at that from that angle with child fatality, but even with PRAMs and some of the work we're doing in Texas and our PRAMs questions, replicating that, but in a way that's more culturally responsive, and to the communities that we're working with to gather more information to support them.
Shannon, I love that you gave that as an example, because it leads us right into this next section here. And that's exactly what we're talking about. I also just want to share an example where at CSN, we recognized this and sort of shifted how we were presenting something. I love this new infographic that CSN put out this spring on injury and violence disparities between LGBTQ and heterosexual youth. And in an initial version of that, it's concerning. There are disparities, and that was sort of what started out front and center on this infographic. And then as we looked at it more closely, we thought, that's not how we want to portray this population. LGBTQ or LGBTQ individuals in this case, which is where the research came from, are an amazing, resilient population that has a very strong community identity, and that can be a real protective factor when that is leveraged. And so we actually reshifted how we decided to frame that message as we pulled that infographic together for exactly this reason. And if you're interested, I just shared the link. But exactly. And so let's roll into spending a few minutes now talking about, this is why we need culturally responsive data collection. We know that there is increasing diversity all across the population, and that looks different in different areas. And when we talk about diversity, we are also, again, talking about race and talking about culture, but also talking about areas that are socioeconomically diverse. We're talking about things that might work differently in rural versus urban communities. There's really a lot of factors to consider. And in the end, we are wanting to look at the populations that are experiencing the most disparities and finding the way to work with members of that population, of that community, that have this context that can help us not only to gather, but to interpret and to share back that data in a way that is meaningful and can drive data-driven, evidence-based change. And so, you know, you think about how do we then do this? I mean, this is aspirational work. And so this particular image, Rebecca pulled from Alan Barsky. It came from Ethics Alive, Cultural Competence, Awareness, Sensitivity, Humility, and Responsiveness. Just kind of like thinking about, you know, sort of what is this progression here for us as professionals, for us that are often the conveners to be bringing people around the table together. Often for all of you, the deciders of where the disparities are and who's getting funding and, you know, what are the strategies that we're going to implement. And so really taking the time at the forefront to think about, you know, where do I fall along this continuum and where do I need to recognize, and when I know better, you know, do better, and to share that with our colleagues and partners. You know, becoming culturally responsive can be really complex. And so, you know, we're thinking about, you know, cultural knowledge, where you're understanding characteristics and history, and values. And so you might be, you know, learning about the different languages that are spoken in your community. But then cultural awareness, you know, kind of starts moving more towards this more mindfulness and being more observant and being conscious of, you know, where are there some similarities and some differences between cultural groups. It also kind of start, you know, is that point at which you're really starting to recognize some of this context that we're talking about, that there are all these other pieces at play here that have to do with power and privilege and oppression and things that have historically and systemically you know, happened over time that are the drivers of often of disparities. And then, you know, we think about cultural sensitivity, you know, starting to have this knowledge and awareness of differences and accepting those, you know, just I think to me, a lot of that on one of the slides previously, it talked about, you know, recognizing and mitigating bias, you know, and a lot of times that bias is an unconscious bias. It's not something we're doing purposely. It's not something we maybe start out being aware of. And so it's moving to this point of being able to take a pause and to recognize, oh, I wonder why that's sort of where I immediately go with this, or I wonder why I have this sort of like gut reaction to this. Let me stop and notice it and think about it, and then you know, try to reframe this or try to then talk about it in a different way. And, you know, really increasing your cultural knowledge and awareness and sensitivity lets you serve that diverse community better and lets you really focus on these disparate populations in a more positive way. And then, you know, as I'm talking about all of this as kind of being this continuum, I think the term cultural competence, which, you know, is this ability of individuals and organizations to understand and to communicate, sometimes it kind of feels like that language of cultural competence, you know, would lead you to believe that at some point you become competent. Like, great, I got there. I got this. I know all about this population, you know, that's in my community. When really what we know is there is always so much more rich history and context, and that we could never know as much about a population that we are not a member of, or even if we are a member of that population, you know, I'm a single parent. I was a military spouse for a long time. I grew up in the Northeast. I've also lived in the Midwest. You know, I have all these things that I bring to my identity. And so I often can have some shared language with the military community, or I can have some recognition of what it might be like to be a military spouse. But my experience also was just my experience, and how my family experienced that, and may be very different from someone else's experience. And so really looking more at this idea of cultural humility is there is always more to learn. There is always more to know. It's like we talked about at the beginning of this webinar of really, you know, coming into this I think if the only thing that you took away from today's webinar, I'm going off script. So I'm just, this is Claire Grace's opinion here. Okay. Definitely not HRSA, probably not CSN. Honestly, I think if you took nothing else away from today's webinar, the idea of approaching everything with a curious stance. I think if we could get everyone that we work with and for ourselves to approach the world in that way, we could make so much more difference. I wonder why this is what's happening. I wonder why the data says this. I wonder why this group of people is having a really hard time with this information. I wonder why it is folks are telling us they know this, but then that's not translating to the action that we're hoping as public health professionals they're going to take. I think the more that we can ask why, and we can wonder why, the more likely we are to approach all of this with humility, and to do this with the context that is going to help us actually make a difference. And then just a little bit more here before we get into some more time for discussion. I think some of this has been said already, and some of this I think we already know is at the foundation of doing this work, right? If we're engaging communities, we need to make sure that we are building relationships and building trust and buy-in even before the assessment process has begun. And so if there has been previous harm to that community where folks have come in and said, hey, come do all these focus groups for us because we want to know what's happening here so we can get this funding and we can come and make a difference. And then someone comes in and they get all that information from those folks, and then they never go back to tell them what they did with that information, or they never go back and use it in service of their community. Or to the point of the question that we had just a few minutes ago, they use it to show in the newspaper the terrible, terrible disparities that are happening in this community that they want to come in and fix. Think about how that feels to be a member of that community. And then that's what you hear back about what you shared. And so much of it goes to building trust and building a diverse group of partnerships, including people that are members of the population that you want to serve. It's about investing time. It's about including community members with lived experience. It's about developing formal agreements of how you're going to use their information, how you're going to recognize them for their contributions, who's going to own this information, who's going to get a final decision about how it gets shared back out into the world. And so, thinking about all of those things, and then just a quick note about when you're thinking about who you're bringing to the table, we're thinking about the direct populations that you want to serve. So Sarah mentioned being engaged with youth, working with youth directly. And then who are those indirect populations? If you're trying to make a difference in childhood injury by reaching parents, parents are that indirect population that you also want to have at your table, because you want to know what's resonating for you. What does this data say to you? And then just a couple additional considerations, that populations that are requiring culturally responsive, requiring, I think everyone requires cultural humility, that you really need to think again, how are we conducting this assessment? Where are we conducting it? Who's conducting it? Those are all really important considerations. And then you'll have these slides available after the webinar, because we want to make sure that we have time. We've got we'll have probably about 10 minutes time for questions and some discussion. But we've got some examples in here of how you might go about this. And so, again, what is the population I want to focus on? I want to know not just the demographics of, what percent of the population is this, but what is some of that historical context? What has happened with this population in this community before that would be helpful for us to know before we go in asking them for data, or before we go in asking them to be part of this process? And where are there existing local resources already? Is there already someone who has a trusted connection, or is there already someone who's already asking them these questions and collecting this data? Maybe we can collaborate and partner together, instead of I'm going and asking on Monday and someone else is going in and asking on Tuesday, and everybody, is just wanting to, keep taking and taking from this community. And then having this understanding, and I spoke to this already, but having this understanding of cultural humility, thinking about your own bias, thinking about, all the things that we've talked about today, the importance of this for all of us and for educating the partners that we work with as we're all doing this work together. And so I'm going to kind of put this question out there for you to take a minute to think about. And again, we really want, some people are quick to jump in. Some people need a few minutes to think. So I want you to think about this question just for a minute. Take a minute to think about all that we've talked about. And then I am going to just kind of real quick talk about our last couple things so that we can then just save the last 10 minutes to both answer that question and to just ask any other questions that have come up. And so I just wanted to make you aware, if you are not already, of 2 resources that I love that CSN has available. We're going to put the links in the chat. There's also QR codes here if you want to find them. One is a health equity planner, and then the other one is a DEI assessment guide that you can use across teams. This might be helpful to use across a public health department, or thinking about, using these with the partners that you're working with. These really help you to put some of these things into, concrete on paper or, on your computer in this fillable document. Who it is you're focusing on, who you're identifying that needs to be at the table, how you're going to go about this work, and really helps you break it into some smaller steps. Also, just always a reminder that we're here to help and support your work. These are just some of the things that CSN offers in terms of technical assistance, but we wear many hats, and we are here for all of it for you. And so these are just a few ideas. You don't have to be focused on a specific process or specific tool to reach out to support. In addition to offering content and process expertise, we can offer support with capacity building, tackling challenges and barriers, and anything that's keeping you from reaching your outcomes. We're going to drop the request form in the chat, but you can also reach out to any of us on the project at any time. And look at that. We truly have 10 minutes. So I'm going to stop the share. You are welcome to come off camera. You are welcome to come off mute. What are your questions? Put them in the chat, come off mute. I'm going to take a minute to take a breath and take a look to see what's been happening in the chat while I've been talking. Let's see. Okay, so Terry had shared in the chat, I think there's a drive to continue to individualize health behavior rather than accepting that systemic policies shape health behavior. Data scientists should have as a goal to continue to show how community health behavior is the canary in the coal mine, showing social determinants of health need rectifying. We've all been talking about this for a while, right? How getting folks, even our own staff sometimes in our own community-based organizations, with this idea of environmental change and looking at the environment and looking at broader evidence-based strategies instead of looking at this as someone's individual health behavior. And Sarah, I see you nodding. Do you want to add anything?
I think in the research, we see that the most power that we have is in those environmental change strategies. And so I think that that's a really important framing to have, is especially when we're saying, like, this is something we should do, to bring up some of that, to say, we have a lot of power if we use environmental change strategies, both power in data and ability to make change. It's also a really cost-effective way of doing it, rather than each individual person. And there's a lot of research on that. So
Shannon has brought up a great, she made a comment, but I'm curious, one recent challenge she says that they've had in Texas that they're evaluating, is, sorry, now I lost it. Where'd it go? It was about
Translating
thank you.
Non-Hispanic
translating,
Black,
yes,
as a term in our data sets is very interesting, to do a scan of all of the national resources that report data, and working with our partners, we have really been intentional in our Spanish translations in Texas, with our infant health programs at Title V, and we evaluated the why behind several terms and how terms were perceived, and really found that there were no there wasn't guidance nationally on this, and we had our partners come in and look at this with us and determined, that we needed to translate it. We shouldn't just be using the English term, and then that using the term Black in a Hispanic translation was not appropriate culturally in our populations, based on the feedback from the communities, right? From the populations itself. So
Shannon, can I interrupt you for 1 second?
Yeah.
Oh, I wanted just to ask you about that point. So when you say you got this feedback from the community, how did you do that? Like, is this
so
something
we
piloted, or
no, we worked with, so we have a communications vendor that both has they are certified translators, but also representative of multiple Hispanic cultures, not just maybe Mexican American, various cultures, and they helped us review the translation options and the meanings behind them in the Spanish language, and provided us context. And then we had that reviewed by everyone to within the agency also. And this is not like first approach at this, to gain a better understanding of this translation. And then now with the materials that we have, we're making that change, and then we'll ask for feedback and context on it again as we share it, to make to validate that this was the appropriate change.
Yeah. Thanks, Shannon.
Yeah.
Appreciate that. What else? What other questions do folks still have, or examples of how you're already starting to integrate this into your work that others might be interested in? We've got about 5 minutes left, so I think we can do 1 or 2 more questions.
I just want to, Shannon, ask, when you find out what works, let us know, because we're using that term as well.
Great.
I mean, and Melissa helped us with that. So Melissa and I will probably be talking about this later, but we just got our suicide prevention annual report approved. So I doubt we're going to go back in and change anything this year, but maybe in the future. But it doesn't affect you until it affects you, right? So I'll give you a good example, and I got to get out of here and go to another meeting. But when I watch a movie, and I'm from the South, and I see an actor trying to do a Southern accent, and it doesn't matter how hard they're trying and how much work they put into it, if they do it poorly, I'm like, oh my God. But I give them grace, because they're just trying to be Southern. But that's just an example of how we may be doing things and not even know what we're doing, because we're not in that culture, and they're too polite to tell us that we're doing a poor Southern accent. And so so I think that's where the key is, in terms of asking people and giving them the permission to tell us, and creating that safe environment for them to tell us in a kind way, hey, Terry, you're being offensive here, and us to receive it, right? And so, but anyway, that's what I thought of when you were talking about that, is that, it can be very subtle, and it can be kind of, okay, you just kind of live with it. You accept it.
Mhm.
And I would hope that we would be intentional about not doing that. And Melissa has helped me some. Thank you, Melissa.
Yeah,
And there's other communities that maybe we're not doing as well as we could. But I got to get to another meeting. Great meeting. Thanks, guys. Thanks, Claire.
Thanks, Terry.
See you guys later.
Thanks, Terry. Nice to meet you.
I think like the one thing that I always say first when I talk about, thinking about who you've got around the table, whether it's thinking about data or starting a process or choosing strategies or whatever it might be, is, sometimes it can be challenging to identify that person, but also in my experience and in the end, it often saves time because you have that person at the table who can tell you right from the beginning, I don't think this is going to work the way you think it's going to work. Or that sounds like an amazing idea in theory, but in this community, XYZ, we don't all have access to be able to answer that on a cell phone, or that, timing isn't going to work because, most people in the community are, busy at that time. I was talking to somebody about finding a church service when I was at AmpChip last year at 7 o'clock in the morning in New Orleans. And they were like, oh my gosh, I can't believe people go to church at 7 o'clock in the morning on Sunday. And I said, the church was packed. And I think it was because most of the people in that service were from a working class neighborhood and they all had to work on Sunday. And so they churched at 7 in the morning and then they had to work. And so, if I was going into that community and I wanted to collaborate with the faith-based community and I was like, great, I want to do a lunch at your church. I'm going to bring in all this pizza and I want to find out from everyone at your church, what they think about this policy. I would have been sitting there all by myself at noon because all of these people that were so wonderful and welcoming to me and wanted to know all about me and where I was from, they weren't there at 12 o'clock in the afternoon. So thank you so much. I want to just share one last comment from actually two comments. Jenny, of course, like making her pitch, which I am a huge firm believer of also, that using quality improvement, right? This is why we do it, because doing these small tests of change is a great way to do some of this. It lets you pilot something. It lets you try it out in one area and see if it works, and then try it in another area and see if it still works the same way that you thought it would, and to make changes along the way. And then Bronwyn, thanks for sharing. Years ago, a colleague explained to me the difference between, I thought, well, I'll read it anyway. Northern and Alabama accents, and the difference was culturally important to them. And so, yeah.
Northern and Southern Alabama accents are very different. That's to Terry's point that he was making. The smallest things can be culturally important to a population.
Absolutely. So I'm just real quick going to share my last slide. Look at us. We're going to wind exactly on time. I can't even believe it. I see that we've already put the evaluation link in the chat. We definitely want your feedback. Please share it with us. We are always looking to improve everything that we do, and your feedback helps with that. If you're don't already have it bookmarked, for sure, go visit our website. We put a lot of resources in the chat that are available on the website, but we hope you'll go explore it. And of course, follow us on social media, and you can find us on all the popular things the kids are doing there. So thank you so much for your time this afternoon. Thank you for bearing with my very fast-paced live near Boston pacing of my sharing of the content, especially in my excitement to get to talk about this with all of you. And I hope that you all have a wonderful, wonderful rest of your day.